Hello, my name is Aurora and I'm a cancer survivor. And this channel is all about sharing tips and tricks to help fellow cancer survivors heal with a little more ease and comfort. And today I want to talk about how friends and loved ones can support cancer survivors. If you like some of the tips that I share, go ahead and hit the like button because it makes it easier for other people to find the video. And if you want to get an alert the next time I post, then go ahead and hit the subscribe button. There are a few different ways we can support cancer patients slash survivors or loved ones with other major illnesses and or major health challenges. And two of the biggest ways we often reach out to assist are with physical support and emotional support. And I want to share some ways to most effectively offer this support such that it grows relationships rather than strains them, because illness can definitely strain relationships. And so that offerings for help and assistance are accessible to the cancer patient and sustainable for the loved one that's doing the offering. Uh, Before I dive into this, I do want to acknowledge that, of course, everyone is watching right now because either you have a diagnosis or because you love someone who is ill. And I know that people make these offers to help because they make them out of love. They make them because they want to do something positive and make a difference. So if I mention that phrasing something a certain way is less effective than it might otherwise be, or that perhaps an offer of help could be made in a better way, this is not an indictment of anyone's offer for help. It's not an attempt to diminish anything that you may have done or are thinking about doing. Some of the things that I'm going to mention um, that could be better stated or approached in a different way are things I myself have done for someone in my own life that was ill. And then I realized, oh, no wonder they never called me for help. That didn't even make any sense. Or that didn't come out the way I thought it would. Let me try again. And so I had to go back and try again and reach out to people again. And so that's okay. We're all just here because we care about each other. And each person is different. Each loved one is different. You know your loved one's best. I may say something that you think to yourself, well, my mom, sister, cousin, whatever, would not react that way. They wouldn't be upset at all. If so, fantastic. You know your loved one's best and you need to do what's best for them. So take these tips as suggestions. And of course, if you know your situation best, and if it doesn't work for you, don't do it. So with that disclaimer, I want to start with emotional support, specifically with the moment you very first hear the news that someone has cancer or some other major illness. My first tip is that it is rarely a good idea to try and problem solve on behalf of another person unless they specifically ask you to do so. When we hear that someone we care about is facing something really, really difficult, it can be frustrating to know that we can't change it, we can't fix it, we can't stop it. And for some of us, that means we just throw up our hands and withdraw. But for others, it might mean that we jump in with both feet and try to problem solve on behalf of the other person. And things that I've experienced that I recommend not doing are trying to figure out why they have whatever they have. I've heard, maybe I ate too much, maybe I ate the wrong thing. If I just start taking the magic supplement their cousin is selling, it will all go away by itself. Maybe I don't exercise enough, maybe I exercise too much. Maybe I need to change my cleaning products slash makeup slash skincare. It's the deodorant. It's probably not the deodorant. I'll say that. There is a time to ask all of these questions and ask about what we put in our body, what we put in our environment, what we put in our food, and the cumulative effect of things in our environment, in our food, and in our products, because you could have a perfectly acceptable amount in one product, but if you use 25 products with that perfectly acceptable amount, is this still acceptable? We don't really know. There's not been a lot of research on cumulative effects of different things in our food. So these are valid questions. They should be asked. But the time to ask them is not when you are offering support to a cancer survivor or cancer patient. You can be cancer Sherlock on your own time. When they're coming to you with news or asking for support, save that. Save that. And I also recommend not questioning their treatment or life choices. Some things I've heard are like, are you sure you still want to work? This sounds like it'll be too much for you. Are you positive that you can still plan on that vacation? Is it wise to elect to take or not take that medication or treatment? You shouldn't get implants. It's bad. Why would you make yourself have all those surgeries? Why don't you just get implants? Remember that every person's situation is different. It is okay to worry about someone you love. It is okay to be worried they are putting too much pressure on themselves or that they may not fully understand risks. But often, usually, those worries are best expressed to your well-hidden diary. To the friend with a proven track record of keeping their mouth shut, or to your spouse that knows when to not get involved in something. So if you're truly worried about someone's choices and that they are not being given full information, think carefully through how and when to bring that up and whether you should bring it up. Their choice may not be the one you would make, but you have to ask yourself, is it more important that they hear your perspective on their choice, or is it more important that they know you support them? Sometimes intervention is wise and someone's doing something that you're like, whoa, this is not good. But more often than not, those things are better left unsaid. So I would approach sharing your opinion on someone's healthcare choices with great caution. If you are a cancer patient who is receiving some pressure to make different choices about your work or your treatment or your life or whatever the case may be, and you want to redirect the conversation without insulting the person, you could say something like, cancer is complicated. There is so much about it we don't know. I am sure that in years to come, we'll figure out why this disease is so persistent. In the meantime, I appreciate everyone who's willing to help me get through the present moment, even if it's tough. Or, but there are so many ways cancer is treated around the world. I am just glad that I have options for how to approach this. And I am really grateful for the people who support me, even if I make a choice they wouldn't make. Saying things like that can let them know that you appreciate their concern, but you have thought things through and you do have a list of reasons why you're doing something or why you're not doing something, and you are not obligated to tell them that list of reasons. That's a choice that you're making. We don't necessarily need to say it quite like that, but there, as I said, there's some methods to redirect the conversation so that they can sort of gently be guided to stop and reconsider that even though they're acting out of love, it really is somebody else's choice. So my second tip is to, as a loved one, try to put aside your own expectations about and emotions about how much and when people tell you about their illness. So when you're faced with a situation that will unquestionably alter the lives of everyone you love in an irrevocable way and possibly even shorten your time in their life, one of the most difficult things to do is figure out how and when to tell them. Do you wait for the second opinion? Do you wait until you know the first course of treatment? Until just before the surgery? Do you tell them all the details or only the basics? How do you break it to the kids? All of these decisions can be overwhelming. So when loved ones tell you about their struggle, don't take it personally if they don't tell you first, or if they wait to share specific details about the news. There may be a million different complications that you know nothing about. My third tip for emotional support is to remember that the ways you might normally try to cheer someone up or make them feel like they can conquer a tough problem may not always work in the case of a major illness. This is really tough because everyone's different. Everyone has a unique situation, a unique reaction, and unique needs, and you may be surprised at how somebody reacts to hearing the news that they have cancer or another major illness. So it is still true that there are some best practices to consider when offering emotional support to someone with cancer. So, for example, trying to make a person feel better by downplaying the problem can come across as if you are minimizing or diminishing their experience or their fear. Even if that isn't what you mean to do, remember that this is a very emotional, often terrifying time. And so saying things like, oh, it's nothing, cancer's nothing nowadays, you'll be fine. Oh, it's only a stage 2, well, you'll be fine. It'll be over in no time. Those kinds of things aren't that helpful. That's really not how staging actually works with cancer. It's more complicated than that. And even something that's only stage 2 can mean a years long journey of multiple surgeries, recovery, reconstruction, years of after treatment. It's rarely just a simple thing. And sometimes when we give verbal assurances, they're reassuring to us because they're helping us believe that our loved one will be okay, but they may not really make the patient feel that much better. Everybody's different, but in the beginning, I recommend that you consider waiting to see how they're taking the news of having cancer before you dive right in with the downplaying the problem method, or with this other method, which is to try and outdo the person to make them feel less bad. I've had a lot of people try to do this to me where it's like, oh, my mom had stage 4 cancer and she's doing great. Oh, my second cousin's husband's third cousin's boss's best friend had to have chemo for 6 months, blah, blah, blah. They always know somebody who had it worse than you and they turned out fine, so it's all going to be okay. Similarly, don't try to minimize how hard their experience might be by telling them how strong they are. I always say this, you are such a warrior. It's going to be great. You're going to breeze right through. So the person who's sharing this news with you is likely feeling very vulnerable. There is zero guarantee they're going to breeze right through, no matter how strong of a person that they are. And what your mom or your second cousin's husband's third cousin's boss's sister did is that's not them. That's not their experience. Another thing I hear too is, oh, you're so healthy, you're going to bounce back in no time. Cancer doesn't care if you're healthy. Often getting cancer doesn't have anything to do with whether or not you are healthy. So you use caution in using these methods to try and encourage people. And if you're a cancer patient and people say things like that, a helpful way to gently redirect the conversation without hurting the person's feelings when it's obvious that they're trying to support you and show love might be saying things like, thanks for trying to be positive about the tough journey ahead. For me, right now, the most helpful thing is to take a realistic look at the challenges that are ahead and plan the best I can. Thanks for trying to be positive about the healing process. The truth is, even the doctors don't know what it looks like or how long it'll be at this point. There's still a lot of unknowns, and every person's body is different. It's good to know that I have your support for the long haul. Or, I'm sorry to hear about your mom / cousin / distant relatives, friend's daughter. Everyone has a different cancer experience and different reactions. I don't know what mine will be like, but I'm grateful for those who support me no matter what. I appreciate your confidence in me as a strong person. I am very appreciative of those who also understand that I won't always be able to be the strong person during this experience, and I'm grateful that I can lean on others that love me. So those are some ways that you can maybe redirect a little bit and let people know you appreciate what they're trying to do, but that's not what you need right now. It can feel a little bit nerve-wracking to say those things, but if you try to phrase it, thanking them first and in a neutral way, just stating what you need and the reality of your situation can often be the best approach. So moving into ways that you can physically help a loved one with cancer or a major illness, or if they're about to have a major surgery. My first tip, and probably the most important, is to be very clear and very specific when you are offering help. That means you, as the offerer of the help, will need to have your own boundaries and a clear idea about what you are capable of doing. So, of course, the first thing that we want to do is when we hear someone is sick, is we want to tell a loved one that we're going to help them. And so very often cancer patients hear things like, oh, anything you need, just let me know. Call anytime. And on the surface, this sounds like a fantastic offer for help. But when you start to think about how to practically implement or accept that offer, it quickly becomes apparent that most cancer patients will never take you up on it, or at least never really feel comfortable taking you up on it because it's a very unrealistic promise. So when someone says that to me, I just think, really? Really? Anything, anytime. So if I call you up at 3 a.m. to be there at my house when my kids wake up in the morning because I have to go to the ER because I took a bad turn, you're going to just come to my house at 3 a.m., then be there when my kids wake up, get them dressed, ready for school, breakfast, lunch made, on the bus, and explain to them in a non-terrifying way that mommy's not here right now because she went to the hospital. You're going to do that anytime. Most people cannot do that anytime. It's not a realistic way to offer help. Most people are not able to drop everything in their life and come help. So what is a more effective way to offer? The first thing to understand is, what are your abilities, right? So if you hate cleaning, then you cannot come clean whenever this person wants you to. If you really are terrible at cooking, you cannot come make meals for this person when they ask you to. So you cannot really do anything anytime. Most people can't. So instead, think about what you can do. Maybe you can make meals. Maybe you can pick up their groceries. Maybe you don't mind cleaning their house, picking up their kids, watching kids in emergency situations, taking up collections to help with buying things insurance won't cover, medical expenses, bills. Be careful with the bills part. I'll do another video on finances, but be careful about giving large gifts and income. Your income and giving large gifts. Make sure you understand the consequences of that, and I'll talk about that in another video. Be sure the person, if you're offering money, is comfortable receiving money. They may be insulted by that. And be sure you don't attach expectations to monetary gifts. I'll talk about that in another video when we're about helping people financially, but you need to understand, if you're going to make this offer, are you attaching anything to it? Can you actually do it? Are they comfortable with it? So think about what you can do, what you are comfortable doing. And then the next piece is to be really clear and specific about your own boundaries. So for instance, if you're offering to go purchase things for them, groceries, for instance, are you really okay with them handing you cash and then you come back and give them a receipt and change? What if they say, oh, well, how come I don't have very much change? Or you spent the whole thing? Or Why did you buy the cereal that cost this much? Why didn't you buy the cheaper cereal? Or why did you buy the cheap cereal? My kids won't eat that. Like, are you comfortable with them giving you a debit card? What if you buy it on their behalf and then they don't pay you back? Maybe they forgot, or they're ill and just couldn't communicate to their partner or spouse that you needed to be paid back. Can you eat that cost? If you say you're going to clean their house, what does that mean truly? Like, is this a very neat and tidy person and they're going to be upset if you don't come in with a steam cleaner and a toothbrush? Or maybe they're the opposite of a very neat and tidy person and there's no way that you could even get through one room in their house in 3 hours because it's a disaster. What exactly are you committing to? And can you do this indefinitely? Are they going to now expect you to come over and clean their house every Saturday for the next year? Are there emotional attachments behind assisting someone? So, for instance, maybe you're trying to help out an ex that you are co-parenting with. What are the emotional attachments that come behind helping someone in this situation? Think about all of those things and understand what your boundaries are before you make the offer. So some ways to do that, some ways to set those boundaries could look like saying, hey, I do grocery shopping every Tuesday. If you give me a specific list and some cash, I can pick up a few things. Then before you go, read the list and ask questions. What kind of butter? Do you need organic? If it isn't enough cash, what should I not buy? Make sure you understand fully what you're doing before you walk out the door with the money. Or you could say things like, I can come by and pick up 2 to 3 loads of laundry every Saturday for the next month. I can come by every other Tuesday and dust, vacuum, take out the trash, and clean the kitchen for the next 3 months. So you're really clearly saying what you're comfortable doing, and you're not leaving open some expectation that you're going to take their filthy house and reorganize it and have it spotless, nor are you claiming you're going to live up to their standards of cleanliness. You can do these things for this amount of time. And sometimes if there are complicated emotions behind a relationship, like I mentioned, an ex-spouse, or maybe an in-law or an ex-in-law, it can be easier to hire help or just give like a DoorDash card or a Grubhub card or something else where you're not personally involved, but you are helping because you feel that you need to help. But be sure that you understand the emotional implications of helping both for the cancer patient and for yourself. So in addition to being really clear and specific about your own boundaries and understanding your own abilities for helping, the next tip is to be really sure that you clearly understand what the cancer patient needs, and don't be surprised if they have no idea what they will need. They may need food, cleaning, childcare, transportation, financial support, emotional support, but they may not know right away what they need because they're overwhelmed. There will be so much information coming at you so very quickly once you are diagnosed, and you will have to deal with your home life, your work life, your financial life, medical decisions, and things that you'll have to deal with those things in ways that you have never had to deal with them before. There will be a lot of things the patient simply does not know. They don't know how their surgical recovery will be. They don't know what reaction they're going to have to treatment. They won't know how much chemo they'll need, if any, possibly until after the surgery. Sometimes they might need chemo before the surgery. They won't know right away how much radiation, if any, or what their reaction to it will be. That's normal. That's totally normal. So when a person doesn't know what they need, as a loved one who's trying to help, you can go ahead and state what you're able to do and let them know that you're going to call you, that when they can call you, and they can say, look, I can do these things. Call me when you're ready to activate that help. Then tell them that you will check in on them in a couple of weeks to see if they're ready to activate your offer for help, and then do it. actually do call them back. Don't just let it fall through the cracks and depend on the person who's dealing with all the emotional issues in the cancer. Don't leave it up to them to call you. Call them back and check. And if they still don't know, call again in 2 weeks and check again and again and again. And just keep checking until they say, no, you know what? I really got it. And if they do really got it, great. But let them know you're there if they don't. So then another tip for offering physical help to cancer patients and survivors is for the survivors themselves, for you yourself. If you are the one with the diagnosis and you need to redirect a loved one who's trying to give you help, but you're like, what do I even do with this? How am I supposed to take advantage of this? Some ways that you can redirect the conversation are to say, thank you so much for the offer. Right now, I am looking for someone to pick up the kids from school on Monday, Wednesday, and Friday, and then take them to piano / soccer / after school care or fill in the blank. Can you do that? Or thank you so much for the offer. I really need some specific availability to be able to take advantage of any help. I won't be able to lift anything over 3 pounds for about 6 weeks, and during that time, I'll need help with cleaning and laundry. Can you let me know specifically what days you're available to help and what tasks you feel comfortable doing? Then I can let you know when I need something. So just be very direct and very clear and very kind. And by the way, being direct and clear is not unkind. In fact, it's more unkind to leave the person out there flailing around trying to help you because they love you and not knowing when they've said the wrong thing. So just let them know, hey, I really just need to know, can you do 1, 2, 3, and what days and times, and for how long? Just get that information. But the most important thing, I think, that a friend or loved one can know about supporting cancer patients and cancer survivors is that they need to be seen and heard. There will be so many instances coming up, and probably there already have been many, that they will need to advocate for themselves when they feel like they're not being taken seriously by medical staff, when they feel colleagues are just writing them off because they're ill. So sometimes they just need to vent. These things are happening to them. It's frustrating, and they just need to have someone listen without trying to fix anything, solve anything, or make anything okay. And being there for someone in that place involves more listening than talking, and it involves asking questions more than it does saying anything profound or making any major offers. So it could look like saying, oh my gosh, I'm so sorry to hear you have to go through this. How are you feeling? Oh no, it sounds like you got a tough road. If you need to vent, just let me know. And then when they vent, don't say anything. Just let them vent. You could also say, oh, I'm so sorry to hear this. I know you have a lot of stress in the near future. If I can pick up the kids on Thursdays / get grocery on Tuesdays / do laundry on Saturday, whatever. If that sounds like something that would be helpful, let me know. Wow, that's heavy news. Is there anything specific you need right now? Whoa, that's major. Do you know what the plan is for surgery? I can come stay with the kids when it happens. How are you feeling? Do you need company right now? Clear, specific offers and questions that ask, what do you need? Company. How do you feel? Is there something I can do right now? One other thing that I want to say before I go, that this is really important. Make sure that you ask if the news they're sharing with you is private. Despite what the internet says, there are many, many people in the world that do not want their business made public. They certainly don't want it broadcast across the planet and helpful prayer requests on social media. And there's often a very good reason for this. There may be really serious implications to their job if knowledge of their illness gets out before they are ready for it to. Depending on the type of diagnosis and the circumstances, there may be legal matters at play. They may have very specific spiritual beliefs, and your prayer chain activation may be distressing to them when they find out strangers know about their health. They may not want certain family members to know. They may need support from friends right now, but they're not ready to tell their kids yet, so they don't want their kids finding out from a big mouth relative. The bottom line is that it is their body, it is their life, and in some cases, it's possibly their death. And so it is their story to tell in the way they see fit, and it's really important to respect that. So make sure you know what it's okay to talk about and repeat. And be in it for the long haul. It is very rare that someone is diagnosed with cancer, has a wee spot of cancer cells removed, and then skips on about their life without further incident. Cancer most often is a multi-year journey, and it can become a chronic illness. So a person could need chemo, radiation, 5 years of follow-up, multiple surgeries, any combination of the above. Fatigue can last for years afterwards. There can be complications, infections, unforeseen circumstances. Depression can last for years afterwards. And it can be really difficult to adjust to a permanently altered body afterwards. So while the intensive phase of you needing help with cooking meals and cleaning house may only be for a year or two or less, that doesn't mean that life will just pop back to normal for a cancer survivor. So I've heard many times, wow, you're still having surgery? Another surgery? You need this? You need that? Yes, I need another one and another and another. And so be sure to check that you're not putting pressure on the person to do and be everything that exactly the same as they always did, because that might not be possible. Cancer is one of those things in life that is a demarcation point. There will always be life before it and always be life after it. It changes everything it touches. So talking about such a big thing is really difficult, and maneuvering life around someone you love who has it is tricky. So if you have said something I suggested may not be the best thing to say, don't be too hard on yourself. And if you're a cancer patient and a loved one does say some of these things, remember that they're still there because they love you. And we are all trying to just take care of each other out of love, and no one is perfect. So be gentle with one another and just try again the next day, because life is too short to let these kinds of things stop us from making those connections, especially when we need each other because someone is ill. So I'll be back in another video with some more tips. And if you'd like to see what those are, then go ahead and subscribe. So until then, stay hopeful and take care of each other.